Assalamu alaikum wa rahmatullah. It's really a privilege and honor to co-chair this session with my dear professors, so thank you very much. Our next speaker is Professor Faisal Shaheen, and Faisal is well known to all of us. Everyone knows Faisal, everyone likes Faisal. خاصة الستات يعني بس everyone likes him. So Faisal contributed a lot to the field of transplantation in the Arab world and if not around the globe. He was the past president of the MESOT and he was for more than 20 years the president of the Saudi Center for Organ Transplantation. Currently, he's the president-elect of the ISOPD and the co-chairman of the WHO Task Force for Organ Donation. Faisal, we always enjoy your talks. تفضل.
Thank you, Mohammed. First, I would like to thank the organizing committee for kind invitations to me to be with my brother and sister from Egyptian and Arab colleague. I'd like always to attend this prestigious Congress. Thanks, Professor May, Ayman, and Amr for your kind invitation. I'm very happy to see this prestigious Congress, as I said, with a lot of information, which again, new even for us as old nephrologists. I will start my talk. It will be very sad to tell you that we lost one of our colleague and friend. How can I move here? This is Dr. Sayari, Prof. Sayari. We lost him last week. Here? Okay. Okay, no. Prof. Sayari, he did a lot for nephrology in the Arab world. And he is with Prof. Hasaballah a long time back, founder of the Arab Society of Nephrology. And probably if someone look for his name, he will find that he contribute by more than 450 paper in nephrology and more than 25 books. And unfortunately, he had lung fibrosis and went to the state where he got lung transplant, successful lung transplant, and he stayed for physiotherapy. Then 3 weeks back, he had COVID and he died from COVID. Till the last moment, he was still contributing by his knowledge and write a paper and write books about the ethics and many other things. Really, we lost one of the eminent nephrologists like Shaisha and Sayari and others. God bless him. Now I move to important issue about challenge of transplantation in Arab world. I think I have a problem with moving this. Okay. We had a problem in Arab world and all MESOT countries because we have not yet reached to the optimal transplantation service from living or deceased donor. It is known that the outcome of transplantation is better if we have a full house or match donor, but still, even if it is less, we have a good outcome, better than the dialysis. And this curve can show clearly that dialysis is down very low, and the transplantation from full match or mismatch, 4 or 3, all of this is better. And again, the cost of the dialysis is very high if we compare it to the transplantation. So we, sorry for that. So we still lag behind transplantation service, and we didn't catch at all till now the world. This is the map showing transplantation worldwide. This is a deceased donor and the living donor. And if we look for some countries in Middle East and Arab, we still very low in this. And the waiting list is increasing. And this is just only in Europe country, which is have one of the most active transplantation in Spain. Still, the waiting list is increasing. But in our situation, our waiting list is more than them. It's not only in Spain or in Europe, but we can find it in Asia. The waiting list is increasing. North America, Latin America, in Europe, Africa, and in all the Middle East. So the number is increasing. Now I look again for the map where they have activities of transplantation. In the Middle East, we can find that Iran, Turkey and Iran is leading, and then Saudi Arabia, Kuwait, Qatar, Sudan, and UAE. This is the number, which sometimes it is a small number if we compare it with the population as a whole, but still the rank of those countries is coming a little bit. If they report also, because the report sometimes country didn't report the actual number. So still there is some doubt about the statistics getting from GODT. Now, the global transplantation, it is known that in North America and in Spain, in Europe, they have the highest number of transplantation. Why they have this? Why they are having such a good number of transplant and we don't have it? We have the infrastructure, we have the surgeon, the nephrologist, hepatologist, we have all the things. Even our skilled surgeon and nephrologists working in the United States and working in Europe, and they are doing for them the transplant. But still, we don't have it in our area here. In Middle East, which is 29 countries, 600 million populations, we could do better than what we are doing now. Here we, again, if we look for living donations, you can see that still we are doing not bad, but not the optimal. This only few countries which can perform living donations, and it is a quite small number if we compare it to the big numbers which they need transplantation. But in deceased donor, only few countries are doing deceased donor in all the Middle East, like Iran, Turkey, Kuwait, Saudi Arabia, and UAE, and sometimes a few cases in Qatar and Bahrain. But still, we don't have a program, organized program in many Arab countries for organ donation. This is just a comparison to see where we are. Up the top is living donations only in Arab world, and some of the Arab world have some deceased and living donation. And if we compare ourselves to Europe, which is down, we are far away from them. They are doing much more better. They are doing more deceased donations more than us. Here we can see examples of that 70 or to 80% of our donations rate is coming from living donation, and the rest is only coming from deceased donation. And in Europe and in the United States, it's completely the opposite. They are doing more deceased donation more than living donations. So as I said that in general, we have mainly living donations, and very few deceased donations. This is Saudi Arabia as an example. We have around 75.5% of our donation rate is coming from living donation, and few coming from deceased donation, which is around 24%, and very limited cases of DCD coming from as a donor. In Europe, and this is the GOD data, 74% coming from DBD, and living donation from 32%, and very minor source is still DCD, but it is growing in Europe and America. Why we have this discrepancy, I will discuss it in detail. There are many people say that it is religious, or it is legislations, or the economy, or the organ OBO, either present or not, or the culture prevent this such a donation, or commercial transplantation, or some other factors. I'll discuss this one by one quickly. So I will discuss first the religious. If we think that the religious is the major impact in transplantation, I think it is not. Why? You can see here the Berber one is the transplantation activity, or this is again the Berber is the Christianity, and the green is Muslims, and you can see the Berber here in North America and in Europe, they have a good transplantation, but still in South America, they are mainly Christian and they don't have transplantation activity like them. And also in Africa, which is Christian, is mainly there in Africa, and they don't have transplantation activity. So again, religious may be not playing a major role in transplantation. About legislation. Legislation, many countries have legislation, and some have opting out system. And this is, you can see it in Scandinavia, in Russia and other, they have opting out system. Yet, still they don't have high rate of donation. So legislation probably doesn't play a big role in this. You should have it, but still it doesn't make a big difference. Economy, they said if you have money, you can do. But this is not true. For sure, it can help you to make infrastructure as a money if you are a rich country, but there are many rich countries and they don't have a good rank of transplantation, and they have a good income. And you can see here in the map, some of those rich country, very rich country, very good income, but still they don't have transplantation. What about OBO? We noticed that if any country doesn't have OBO, which is Organ Procurement Center, to oversight the transplantation, regulate the transplantation, they don't have enough transplantation. So we think that if any country have OBO, is essential to have more donation. All the countries which have OBO, usually they have a high rank of transplantation. Again, it's the culture play a role. The culture, as you know, that it is combined of education, economy, religious, politics, healthcare, all of this going together to make the culture. And the culture even is different from within the country itself. You may have different people, different culture within the country. Still, is it working? Yes, no doubt it is prohibit sometimes transplantation in some area. Some people are very rigid against the brain disc. Some people doesn't like to touch their this body after this. So still the culture play a role, but not major role. But I think again, it is very important, especially the education. If we don't educate our people from a child to donate, we will not get it when they become adolescent or adult, that they are not going to donate. So the culture play a role, but not 100% rule for that. Okay, this is, as I mentioned, the culture even within the same country, can play work. So we can have an area where they are very rigid against the transplantation. One of the important issues is the transplant tourism, which again, I think this is against transplantation in any country. If we have people, rich people, moving from one place to another, either to get a kidney or to buy a kidney and to get in another facility, this will hinder any transplantation program within the country. And this is what we have it, as you can see, that there is ethical movement, like if I am in Saudi and I want to have a good facilities in Cairo, I'll come with my donor, which is my relative, and I can do it here because the people are famous. There is no problem about this. But to move and to take a kidney from the other place and to buy a kidney or liver, this is unethical direction of transplantation. But even that one expand more about the kidney donor, about the donor and the selling and the buying organs. So you can move the people from different place to another continent, another country far away to get a donor, or the donor move to you, or the surgeon and physicians move to you and do the transplantation. All of this makes the transplantation activity less in that country. Again, I have to emphasize that 5 to 10% of the transplantation every year are done by commercial transplant, even if it is not apparent, but it is 5 to 10% minimum are done by commercial transplantation. That's why we have what's known as the DICG, Declaration of Istanbul, which prohibit the transplantation to tourism and people to move. And this, out of this, actually, there is the good outcome that at least we don't have any commercial transplant at the moment. This is the, as I mentioned, 10% transplantation activity as commercial transplantation. It is everywhere, and you can find in the news, in many news about this transplantation activity. And after declaration of Istanbul, this number decreased. And after COVID, this number completely decreased of commercial transplantation. There are many other factors, which is the hidden factor, especially the people who make the legislation. They are not aware about transplant. They are not convinced with the transplantation. So they make it very difficult for the donor to be accepted. So the other things is legislators themselves, we have to let them to be convinced about transplantation. Medical community in large, we have to let them to know about the transplantation, improve their education. And in public as a whole, we have to bring the trust to the public in order to give donations after that. There are many models which are quite good in the world, like Spain, we have to look for them. Croatia, we have to look for them, how they improve the donation process. And I will conclude quickly by 2 slides, which is very important, I think, for us. First, to know that transplantation, we have to be fair and transparent in transplantation. And the contributing factor for successful transplantation are mainly presence of OBO and the other medical community in large, and we have to play also with the culture. The other things is not important, so OBO, legislation, government funding, support religious authority, and direct approach to the training of the medical community. I conclude, Mr. Chairman, that still we are lacking behind in disease donation especially, and we have to work hard in order to improve it. The key point is to have OBO in each country, in Arab and Middle East, and this to promote organ donation. Thank you very much.
So, thank you very much, Dr. Faisal. For the sake of time, we're running short of time. We'll leave the discussion to the end of the session, if you don't mind.